Mabuhay future nurses! This is Edmond M. Bigata, a BSN 2B student of Camarines Sur Polytechnic Colleges. And in this video, I will be demonstrating the bag technique. So first, we have to define what a public nurse bag is. So a public nurse bag is a tool used by nurses during home and community visits in order for them to render care to their patients. So, the nurse's bag has three kinds of contents. The article for infection control, article for assessment, and article for nursing care. The article for infection control, of course, contains all of the articles that helps the nurses to prevent the transmission of infection, of disease-causing agents. Like we have the alcohol, the soap dish, the soap, the towel, and others. Next is the article for assessment. These are the tools used by nurses to assess the current health status of the family, a certain member of the family, or an individual. This includes the sphygmomanometer, the stethoscope, the glucometer, the pen light, the thermometer, the baby weighing scale, and any other equipments used in assessing the health of the family. And the last article of the nursing bag is the articles of nursing care. These are the equipments and articles that we use in performing certain interventions to our client. It has sterile items, clean items, and papers. So the sterile items includes the gauze pads, syringes, the sterile gloves, and any other. The clean items includes the bandage scissors, the bandage, the micropore tapes, and any other, and a lot of papers. The paper will serve as our lining in order to prevent the bag and the contents of the bag from being contaminated. So when performing bag technique, we are following certain principles. First, the first principle of the bag technique is the first principle of the bag technique is inform the nurse or remind nurses of infection control. Upon opening the bag, the first thing that you will be seeing is the soap and the dish soap. So from that, we'll be reminded to wash our hands, to perform proper hand washing in order for us to lessen and reduce the transmission of bacteria like Staphylococcus, Diplococcus, and any other bacteria or disease-causing agents. The second principle is it helps us nurses to render care efficiently since everything that we need is already in the nursing bag. We have just to make sure that the nursing bag is complete. That's why when we render care to the client, we are giving them the care that they need. Next is we have to focus on the patient. Yes, it is a principle that we have to keep the bag from being contaminated. But we have to focus on the patient. Kailangan nating mag-focus sa pasyente. Huwag tayo na, uy hala, yung bag ko, contaminated na, to the point na naiwan mo na yung pasyente dahil iniisip mo yung kapakanan ng bag mo. So always remember that the patient always comes first. Now, the second thing is we have principles for infection control. First is we have to perform clean procedures before performing contaminated procedures. Next is we have to wash our hands before and after the procedure. We have to line the nursing bag with plastic linings and paper linings in order for it to not be contaminated by the articles at home. And never ever put home articles on the lining of your bag. And we have to bring additional plastics where we will be putting the contaminated items used in certain interventions. We are not allowed to put back all of the contaminated items inside the bag because it will contaminate the uncontaminated items in it. So, without further ado, I will now be performing the bag technique. So now, we will be proceeding on the proper bag technique. So there are many kinds of public health nurse bag, as we all know. We all know that. But the sling type version is the one that I've got. So, upon arrival on the patient's house, on the client's house, we have to look for a flat surface or a table. This is where we are going to put our PHN bag. But before that, we have to line it first with a plastic lining and a paper lining to avoid the bag from being contaminated. So, I already found a flat surface. So, what we need now to do is to line it with a plastic lining. So, the folder part should touch the table. And the clean part should be the place where we will be putting the bag. After putting on the plastic lining, we will now be putting on a paper lining. Again, the folder part will touch the table. Now that we have already put protection for our bag, we can now put the bag on the table, ensuring that the sling will be put underneath to prevent it from further contamination. Now that we are ready, we will be asking the client for a basin of water, a glass of water if tapped water is not available. Ma'am, Mami, pwede po akong makahigang po ng planggana tapos tubig po para makapaghugas din po ako ng kamay. Salamat po. So, assuming that the client lent us with a basin of water and we've already washed our hands, we will be opening the bag. Put out the soap dish with soap and the towel. After that, we will be putting on the apron. So we will be wearing it on the right side. So this is the apron that I've got. There. After putting on the apron, we will be having hand washing. Mami, pwede po ako ulit makigamit ng sink po ninyo. Maghuhugas lang po ako ng kamay. Salamat po. We will be drying our hands using the towel. Now, here's the thing. While we are having hand washing, we can have health education. We can teach the client the importance of having proper hand hygiene and how it is done, how proper hand washing is done. Now that we are already done with the hand washing, we will be pulling out all the things that we need to perform nursing care. So the first thing is I will be measuring the fundic height of the mother. So what we need is a tape measure, and cotton balls soaked with alcohol. After measuring the fundic height, I will be performing wound care. So what we need is a sterile gloves, gauze pad, the antiseptic solution, the micropore tape, the forceps, scissors, and a ready-made receptacle. This receptacle will serve as our trash bin. This is where we're going to put all of the contaminated items once we've used them. For example, they used gauze pad from the wound, the cotton balls, and the other paraphernalias. Now that we are already prepared to do the nursing intervention, we will be closing the bag and proceed. We can now implement the intervention. First is we have to apply the principle of clean to contaminated. We have first to perform a clean procedure before performing a contaminated procedure. So in this case, we will be performing first the fundic height measurement before performing the wound care. Okay? So, Mami, higa na po kayo, may measure na po natin yung fundic height po ninyo. Okay, now I already measured the fundic height of the mother. Now we will be having the wound care. So, Daddy, upo po kayo dito. Lilinisan na po natin yung sugat po ninyo sa paa. Upo na po. Okay, so let us assume that we are already done with the wound care. Now, what we need is to sanitize all of the equipments that we used and put them back in the bag. So, just a reminder, I brought here another plastic bag. This is where we're going to put all of the contaminated items once we've already used them, such that the receptacle and the wastes, the surgical pads, and the sterile gloves. Okay. Now I will be sanitizing the tape measure. And the antiseptic solution. And once we already sanitized it, we will be putting it back inside the bag. Now we will be asking once again the client to use the sink for hand hygiene. Mami, makikigamit po ako ulit ng sink for hand washing po. Sige, salamat po. Now that we are done with hand washing, we need now to remove our apron. We have to make sure that the contaminated part will be folded inward. So like this. Will be folded inward. And this will go together with the paper towel, and dish soap with soap. So, because we performed wound care a while ago, the forceps will be covered with paper, and we will be putting them on a separate container or on a separate sheet. We will be sterilizing these items when we go back to the RH Rural Health Unit using an autoclave or Sidex. So I have here another plastic bag. this where we are going to put all of the contaminated items, such as the apron, the paper towel, and the forceps that we've used. Also this one. So, now, we will be closing the bag. And we will be documenting the findings. We will be talking to the head of the family, to the mother or to the father regarding our findings, and tell them when are you going to visit them again, or if they're going to go to the clinic, to the rural health unit. And while talking to the father and to the mother, we should also teach them on how to do simple procedures. We have to remember that it is a goal of primary healthcare to be the primary goal of the primary healthcare is to teach people how to be self-reliant, how to be independent when making decisions regarding their health. So by teaching them how to do simple procedures by themselves, we are helping them to be self-reliant. We are helping them to be independent in making health decisions all by themselves. Okay? So once we've document all the findings, the assessments, we will now be getting the bag and fold the paper lining again the same way we folded earlier, as well as the plastic lining, and place it on the pocket outside the bag. Or if your bag doesn't contain any pocket at the back side, we can put them together with other contaminated items. And we will be bringing them now to the rural health unit for sterilizing. So that's how we do the proper bag technique. Thank you and have a good day ahead.